glossy that you sent out to everyone, I think many people got it, claims in about the same words that Mr. Ryan did in his Wall Street Journal piece, that future Medicare beneficiaries will get the same kinds of plans as enjoyed by members of Congress. You probably know, though, that there is a crucial difference between the two kinds of plans, and that is that the congressional plans are indexed to the premiums that the insurers charge and rise in step with them, so that the so-called fix that you described for Medicare indexes the vouchers to the consumer price index, right? So the CPI, the consumer price index, has grown at a much slower rate than health spending, especially in the last 10 years. And so, in fact, if you index the Medicare to the CPI, you're going to, it will result in shifting an ever greater share of medical expenses from the federal budget to household budgets of the elderly and the disabled. The CBO said they're looking that that we're looking at bearing 68% of medical expenses by 2030, the elderly, that is. And that's just not a future that I want for my children. And my parents, who are in their 80s, I will tell you, can barely afford the 20% that they pay that Medicare doesn't cover, let alone any more than that. So I'd like you to try to explain why your brochure said that this would be some kind of a benefit. It seems misleading to me, and why you support a plan that will quite literally result in unnecessary suffering and early deaths of many future seniors.
Well, first, let me start with this. I support the notion of preserving and protecting both Medicare and Medicaid. I think that's very, very important public policy. I think that most Democrats and Republicans in Washington agree with that notion. I also feel that we have an obligation to try to solve the problems that we have. The President proposed his budget back, I believe, in February, and there were no proposals or ideas or solutions relative to the entitlements. Yet he has mentioned, not just in the State of the Union, but other subsequent speeches, that the entitlements have to change, that it's not sustainable in the current conditions, and that if we don't, you may not have these entities in the out years. So there at least is general agreement, at least from the President of the United States, from members of the Senate in both parties, and a member of the House in both parties, that we've got a responsibility to do something. Secondly, anyone who's 55 or older in this proposal is grandfathered, not one change. So anyone in this room, anyone who is receiving those benefits, if this were to become law, would not change one bit. And I think, and the reason that that was done is because people at or near retirement have planned accordingly for these programs. And the thought was, you know, let's not include those individuals in trying to manage or amend or change the program. In terms of how you would be treated beginning in 2021, if you were outside of that 55 and older bracket, the reason I say that this plan is like a member of Congress's plan, because it is. Well, a member of Congress gets a book, has a list of choices of government-sponsored health insurance that he or she can choose. Medicare, when you're 65, you're going to get a book that has government-sponsored health options that you can personalize for yourself, and a minimum of $15,000 will be paid toward that premium. You can decide how you would like to prioritize your medical requirements and medical needs. It's an idea. It's a solution. And what I feel is that America wants to see us talking about solutions. So this is a plan that's on the table. It's a plan that will be continued to have debate, and it should. And I want to continue to hear from people on what your particular thoughts are on this or, again, anything else. But we still haven't seen anything yet, and I hope we do, from the Senate or from the President. But in the economic conditions we're in, we've got to make some changes in this country. We've got to make sure that we offer a better country to our kids and our grandkids, and that means enough is enough with the Washington spending. Let's be responsible by being honest to the country about the challenges we're in. And let's do everything we can to reduce our $1.6 trillion deficit and our $14 trillion debt. So this is a step, I think, in a direction to say we've got ideas. If the country would like us to alter it, change it, tinker with it for a bit, I would invite any member of Congress to work with us to make that happen. But I'm going to be in Congress to try to solve problems and to work on your behalf and your benefit.
Dr. Miles and June Walsh of North Conway.